Welcome to another Mindful Health Discussion. Today's event is called Harmonize Your Heart Health. Make every beat count. I'm Esther, founder and CEO of Mind Myself, and it is my great pleasure to be hosting these events. We are at our 1 year anniversary, and we've hosted 10 online events on Zoom. So this is a milestone celebration, and I am thrilled that our practitioners are here and that all of you have chosen to join us. I know the time is precious and you're choosing to be here with us this morning, this afternoon, this evening, whatever time it is for you in the world. So thank you. And thank you to my team. We can't do this on our own, and this is all such important work. As we get going, I want to just share the Mind Myself vision. I'm going to mute people here. There we go. The Mind Myself vision has many features to it, but the primary one is cultivating unity in times of divisiveness. You may have experienced some of that over the last few years. And the other part is to help you feel seen, heard, and supported in your health journey as you become your own best health advocate. Yes, we need information. Yes, we need to connect with practitioners, but ultimately, you are in your own body and you know your own body best. And with some guidance, you can become your own best health advocate. Congratulations on being here and prioritizing your health. Not everybody does. And you are taking action today by being here. So I'd like everybody to raise your right hand. Yes, thank you. And put it on your heart. And just take a breath, because here we are acknowledging our heart today. Thank you for that. And in the chat, we're responsive all the way through. Tell us what questions you would like answered in this session, because the last 30 minutes are going to be a Q&A, so you can write them in the chat or keep notes beside you. What do you need? How can we serve you? And what questions can we answer for you? And I have two housekeeping items. One, a land acknowledgement. It's really important to acknowledge where we came from, where we are, and where we're going. So I am privileged to live, work, and play on the traditional, ancestral, and unceded territories of the Semiahmoo, Katzie, Coquitlam, Kwantlen, Kakite, and Tsawwassen First Nations, also known as Surrey, BC. And any discussion on medical anything needs a disclaimer, so here it is. All the information and advice from Mind Myself and the practitioners is for general education purposes only, and is not intended to be a substitute for professional medical advice, diagnosis, or treatment. The information here and on the Mind Myself website should not be used to self-diagnose or self-treat medical conditions. We always recommend that you consult with a doctor or other qualified medical healthcare practitioner for individualized medical advice on specific medical issues. The views and values of each practitioner do not necessarily reflect the views and values of Mind Myself. An opening quote for you. When I was researching this, I came across this idea and I went, maybe it'll make you do the same. The Faustian trade of the 20th century was, we got 30 years of additional life, but in return, we got heart disease, cancer, stroke, Alzheimer's, and sensory impairments. The question is, what Faustian trade are we making now as we go after heart disease, cancer, stroke, and Alzheimer's? And then on a more positive note, your heart is the compass of your well-being. Follow it wisely. Welcome to our three phenomenal practitioners today. I'm going to ask you to introduce yourselves, but I'm going to name you right now, all three of you. Dr. Claire Westmacott, Dr. Vicky Mondlock, and Bridget Riggs. I am so profoundly grateful that you are here. Dr. Claire, please kick us off with a short introduction of you and your practice over the 50 years you've been doing this.
Yes. Okay, thank you, Esther, for this opportunity. And as I said, it's hard to combine 30 over 50 years of practice into 30 seconds, but I'll do my best, but it won't happen. So, but anyway, just to let you know that I am a graduate of the University of Western Ontario's Medical School in London, Ontario, Canada. My wife Carol, a registered nurse, had a solo rural practice for 23 years before relocating to Alberta, Canada in 1999, which included a daily office family practice, hospital admissions, in-hospital patient care, emergency departments, and on-call rotations. Family practice obstetrics, delivered over 800 babies, two of them actually in cars, nursing home duty, house calls, as well as being a medical advisor for home care. In other words, I was that typical old-fashioned busy country doctor. And we actually even had an injured fawn brought to our door at our house at one time as well, too. But I'm a practicing family physician and a member of the College of Physicians and Surgeons of Alberta. But I've also been able to have acceptance to practice homeopathy. In 1998, I trained as a homeopathic doctor at the Royal London Homeopathic Hospital in London, England, where I achieved the status of LF Hom, returned to England in 2006, successfully achieving my MD, medical doctor, MF Hom, which is a member of the Faculty of Homeopathy, of which I am still a member. I've also lectured extensively across Canada to healthcare practitioners and non-practitioners. As mentioned earlier, I work with my wife, Carol Westcott, a nurse. We both have a deep desire and commitment to assisting women in reaching their full potential in all aspects of their life. In order to provide more comprehensive care and a greater insight on all levels, Carol and I made that conscious decision to combine the feminine and masculine principles by working side by side with each of our patients in a relaxed and comfortable atmosphere. Homeopathy, which dovetails perfectly with the spirit mind body axis, has been our deep love and has been a major part of our integrated medical practice for over 25 years. Presently, we continue to practice, but are now working exclusively with all things homeopathy, infused by spirit mind body.
Fantastic, Dr. Claire. Wow. So many amazing things, like you said, 50 years of practice. Dr. Vicky.
Well, it's pretty hard to follow up on that. Thanks, Dr. Claire. I am a retired wellness doctor. I started my career as an OBGYN, added complementary alternative medicine, added regenerative medicine, added energy medicine to my practice, ended up doing a solo practice because the other 7 physicians in my practice that I was president of the organization said they didn't want to have anything to do with wellness. And I said, you guys are missing the boat. You're missing the future of medicine. And I walked. And for the next 20 years, I actually did, as promised, all of the total approach to a patient. I became the physician trainer for the organization that I actually became a part of then, helping train other docs how to do what I was doing, took my research and compiled it into original graphs that show where women's and men's hormones should be over time. In other words, not just are you in normal range, are you age appropriate for your hormone levels, and are you where you should be? And then hormone balancing those 4 main hormone groups for best foundational health. So I just retired from that, but my work is not done. So I am here to not only be on this esteemed panel, but I'm writing books and I have other books coming. So that's me.
Thank you, Dr. Vicky. And I know we're in the stream of recording some podcasts that will also be available on the Mind Myself website. So thank you for that. Bridget, tell us about you.
Sure. So my name is Bridget. I live in Tampa, Florida. I have 2 lovely grown-up girls and 3 lovely grandbabies, all girls. So I know estrogen like the back of my hand. And it's a good thing. My poor husband's a former Marine for 20 years, been married to him for 38 years. Actually, this month we're celebrating our 38th year being married. We were fortunate enough to live in Hawaii for 5 years. That's when the whole holistic part of my learning experience. Started with reflexology, then I became a licensed massage therapist. After 10 and a half years raising my daughters, I went back to college. To finish, I got my master's in molecular biology. I am proud to say I have 13 publications in scientific journals.
Wow.
And I did 10 and a half years of cancer research, which changed my life. Not necessarily in a good way. I ended up getting Hashimoto's, which is an autoimmune disease. And after 10 and a half years, I had so many horrible symptoms and the pills didn't work. I tried everything. I had to quit my dream job and become a healthy person, and I didn't know how to do that. So I started with meditation. I got a Chopra certified primordial sound meditation instructor, and then I started practicing a 3,000-year-old healing art called Jin Shin Jitsu, and it's like acupuncture, but it's no needles. You just simply use your hands and place it on your body. And I have become from a scientist now to a healer, and I am sharing my Hashi's hell story to show everybody that we can go from Hashi hell to Hashi heaven by simply having a self-care practice, which I have mastered. And I have an academy right now that I'm starting in March, where I'm hoping 90 days, it took me 18 months to heal my body, but I didn't know what I was doing. So 90 days, I have this program down. So I'm hoping for the best for that program, and we'll see what happens. So thank you for allowing me to be here with two amazing doctors. And I'm just here to share my story and help others heal their body naturally.
Fantastic. Thank you, Bridget. Wow. There's another quote, and it's by some actor, so it doesn't matter who. A healthy outside starts from the inside. And I think that's a beautiful way to start our conversation about specifically heart health. And why is a conversation about heart health so crucial today? Really, why should we be doing this? Dr. Vicky, can you start us off?
Well, the heart is the center of your body. It is one of the main chakras in our body. It's part of our circulation, which goes to every organ system in our body. And what many people are totally unaware of is how their lifestyle affects their heart, how their diet in particular may or may not affect their heart, how different hormone groups affect their heart, the 4 main hormone groups. And in particular, if women realize that estradiol, men realize that testosterone, the job that they do is to increase blood supply per square inch to tissues with estradiol and testosterone receptors. Well, that begs the question, which organ systems in the body have those estradiol and testosterone receptors? All of them. All of them. So think about any part of your body you wouldn't want seeing either your estradiol or your testosterone. I can't think of any part of my body I wouldn't want getting that blood supply per square inch. That implies nutrition in and toxins and waste products out, as well as oxygen in. So why wouldn't we want that?
Fantastic. Thanks, Dr. Vicky. Bridget.
So the heart chakra, we got one, and once it stops, we're no longer here physically in this body. So we must take care of it. And the heart chakra, we've learning so much, and technology now is getting better, so we can see visual things that we couldn't see 10 years ago. And I saw an amazing video of a woman in a room, and they had a heat camera showing her heart chakra, and it was illuminated, but you could still see her silhouette. When her child came in, the whole entire room lit up so much you couldn't see physical bodies. That's how much the heart chakra is so powerful. And we haven't even touched what we can do with the body. We're so thinking it is just a physical body. We're not. We're a soul. We're a spirit. And we can do so much. So the heart chakra, we need to protect it and nourish it, because we got one and we need to take care of it.
Thank you, Bridget. Dr. Claire, from your extensive experience, why is heart health so important?
Well, I think both Bridget and Dr. Vicky have outlined things very, very well. But I think the most important thing is, our heart is our connection to our divine self. Through the heart chakra, excuse me, through our sacred heart. That's how we connect to ourselves. That's how we bring in that pattern, that information into ourselves. And so what we need to do is making sure that we have the heart on the physical level working as well as it possibly can, so that we then are able to bring that in, that information in from our divine self, and therefore expand ourselves. And through the work you're talking, Bridget, about some of the things that you were seeing through the work of heart math, you're able to see there how much our heart expands and what it brings not just to us, but also to the people around us. So it's important for us, not only for ourselves, but for everyone around us to have a properly functioning heart at all levels.
Wonderful answers. And how do our changing hormones affect our heart health? And Vicky, I'm going to get you to bring us up at the end on this one. But Bridget, could you talk a little bit about that to start? How do our changing hormones affect that?
Well, being a woman and going through menopause, hello, hormones, right? We haven't even understood a lot of the hormones, how they've been created, how food, thought, exercise, movement changes and affects hormones. So it's so important to understand the complete system. And I'm not a doctor, so I can't talk on half the stuff that these two doctors can. But from my own experience, hormones can be a challenge, but when you can relax and understand that your body is here to just be a vessel to carry your soul, and you need to treat it like a good vessel. And the hormones that we have, we don't even understand. Sometimes they make us angry, sometimes they make us sad. So to have an understanding that it's okay to feel all these ranges, that's what we're here for, to feel and to have these emotions, but to have grace with ourselves. If we're frustrated because we don't understand our body, or we get that rage from menopause and we're doing things that we never thought we would do, like getting out of a car and yelling at road rage or something like crazy like that. So you just really have to understand and come from grace with these changing hormones, because it's going to happen no matter what. You just got to have a different perspective on it.
Thank you, Bridget. Dr. Claire, what's your perspective on how hormones influence our heart health?
They do. And I think what we can say is the hormones do change, and especially you can see this within the feminine aspect of life as well too. Part of our practice was the last 25 years is we worked with bioidentical hormone replacement, not in a way of trying to override the system, but as Dr. Vicky said, in a way of balancing off age appropriate bioidentical, not synthetic, but bioidentical hormones to the body and given in the way that the body does. And I can say that in our 25 years of practice, the women that we had on the balanced hormones, we did not see any of them actually end up with any heart disease or any heart symptoms showing up. So it shows what you can do if you're balanced. Of course, we worked with the homeopathy, we worked with helping them with their programs so that they wouldn't be as reactive to those hormonal changes. But putting it all together, it is a very, very important part of it, because especially for women, but men too, they just don't know it. But for women, it's really important to know that when things are off and this doesn't seem right to them, it's their hormones probably that are getting into play, that allowing their programs to show up more.
Thank you, Dr. Claire. Dr. Vicky, I know you got lots to say here.
Oh, I have so much to say. I'll try to keep it to two thoughts, okay? Number one is, especially women, we go through a bell curve of what our female hormones do. And a bell curve looks nice and smooth, but on the beginning and on the end, it's choppy. As it's going up or going down, it's only smoother in the upswing of the 30s, 20s, and 30s. So that being said, the average age of menopause, at least in the US, is 50 and a half years old. Now, realize menopause is only 100 years old. The average age of menopause, or the average age of women longevity back in 1912 was 48 and a half years old. We hit menopause and we died. So menopause is a very young science branch, okay? Realize too that women, it was considered unethical to do research on women until 1990. Well, wait a minute. So first of all, you were going to be dead. Then you couldn't do any kind of study on anybody until 1990. And then we were told by a very false study that I will leave unnamed, that hormone was bad for you. And there could be nothing further from the truth, because what we actually did in the really bad study is it wasn't looking at human-based bioidentical. It looked at pharmaceutical hormone that was Premarin, pregnant mare's urine. What? Horse pee? Yep. And Prem Pro, which the Premarin is bad enough, but the Pro is a synthetic medroxyprogesterone acetate that even the head of the North American Menopause Society very clearly stated this is the cause of the increase in breast cancer, heart attack, and stroke. But nobody listened. Nobody listened. So realize that we have this bell curve, okay? We haven't had any research done into it. This is my research that says it's a bell curve, but we make hormone from age 12 to 50 and a half, and it's so good for us. That's how we have babies and families, right? Why is it therefore so demonized and so bad for us from 50 and a half onward? That's a total disconnect, right? It's not that at 50 and a half, we suddenly become different people. It's that suddenly our ovaries stop working, but what they want to give us as a replacement is not human-based bioidentical. They consider us test tubes and horses, and we're not. So that's number one. Oh dear, right? But number two, and now I'm going to go a little researchy on you, is when American researchers finally got enough, I don't know if it was gumption or enough shame or enough what, that they said, well, gee, the Europeans did all their research on bioidentical. They came to the opposite conclusion that bioidentical hormone does decrease breast cancer, decrease heart attack, decrease stroke, decrease osteoporosis, and by the way, anybody who's listening, decrease risk of Alzheimer's. What? Right? So why is there this disconnect? And what does that really mean? Well, when American researchers looked at cardiac, what they found is actually, and this is American research now, the arrogant Americans, who said, even if we start women less from 60 years old or younger, they have a 39% reduction in cardiac mortality and a 32% reduction in all mortality. So what? Why aren't we shouting this from every rooftop out there? This is Dr. Hodis in his lab putting this out as American research saying, newsflash, newsflash, hormone is good. But I'm going to challenge even their meta-analysis that said it's good to start women age 60 or younger. Why are we just saying, oh, at 60, we cut them off? Wait a minute. You're just delaying menopause 10 years. And now you're taking away their lifeblood? It's that nobody looked. Nobody really looked. And I have so many stories, I won't go into them, but of women in their 80s that were on hormone and their bodies acted like 50. And what is wrong with that?
I love it. What is wrong with that? Nothing. Let's make it happen. This is amazing.
And Esther, I'll just say one more thing too,
Yeah.
back to the bioidenticals of how important they are, for the person, but also proper assessment of it. Because from our understanding, the ovaries are the primary place where progesterone is made, not the Provera stuff, but progesterone. And so that's the first thing that goes. And so what we have found a lot of times is sometimes people are being put on estrogen only without the progesterone, which is in our consideration malpractice. And for a lot of people, they only need the progesterone to balance it off. And the one thing that we have done too is we've tested with saliva testing to give us the opportunity to see the free hormone that is there. And so that we were able to assess what was happening with the person. So that was just an aside of how we do things.
Thank you, Dr. Claire. Dr. Vicky,
Yeah.
I know you want to talk about
Yeah.
blood. Go.
Yeah, and Dr. Claire, I'm going to just give you my perspective on saliva versus blood. I had so many patients that would come from a practitioner that was doing salivary, told their levels were wonderful, and I would check their blood levels, which is the European way of doing things, and they wouldn't even register. They wouldn't even show a number. And I would say to a patient, this is why you don't have any resolution of your symptoms. And by the way, you cannot absorb calcium from your diet unless your estradiol level is a level of 30. So I need to make sure that we get adequate estradiol into you and then balance it with your progesterone, because yes, you're absolutely correct. The body does not make any other source of progesterone, even though our body fat makes and converts our estrone to estradiol. But that level of blood work is, I always followed the European recommendations of doing blood work because that was what the rest of the world was using versus salivary. So that's just the way I did things.
I love it. We're
And
going.
just one more thing from our perspective with that. We've also had women coming into, like when we did the saliva test, like all tests, you make sure you balance it with the hormone, with the person, and looking at the symptoms, and if things are out, you're looking at it. But the other thing that we have found is we had a number of people coming into us with symptoms, and told that their blood levels were perfectly normal because it's protein bound blood levels were perfectly normal. And yet when we did the saliva test, we found they were over the top with it. So it's just a matter of, from our perspective, that's what worked best for us when we combined it with our clinical practice. And we found that we were able to monitor people better from our perspective. Obviously, other people have other ways of doing that as well too. So just a difference in philosophy and testing, but that's what worked for us.
Thank you. And on that note, let's go into some symptoms. What are some of the symptoms we experienced during or as a precursor to heart incidences? And Dr. Claire, can you start us off with that? I know you just took a sip of water there.
Sometimes it's just a case of feeling off. Something's not quite right, or they're not able to perform the way that they would like to perform, where they had been doing things properly before. So there's that aspect, or some, especially for women, because they don't always present the same way that men do when it comes to cardiac symptoms. But it could be just a shortness of breath, or it could be some chest pain or chest discomfort, but not in the traditional left side going into the jaw kind of thing, more appearing to be epigastric or GI symptoms. But I think it's just a lot of it is just that things are changing. They aren't able to do what they're wanting to do, and they're not aware of the fact that so much of it is related to their stress sympathetic nervous system overdrive reaction in the body itself, because women, I think because they are with the feminine principle are more attached to the emotions, and we as men are very, very good at letting women take care of all those emotions, and we just go on in our own way, that they're not even aware that they're under stress because they think they're dealing with it.
Thank you, Dr. Claire. Dr. Vicky.
Well, one of the first symptoms that I would always see in women were heart palpitations, heart racing. And they would say, gee, is this my acid reflux acting up, or is this really my heart? And, sometimes you have to send them for either an EKG, but in the office, or even over the phone, you can have them do some simple maneuvers like check their pulse, do a couple of deep breaths in and out, recheck their pulse. And you can actually make a difference in calming somebody down with just knowing what their pulse is. A second thing, a trick I would do, especially if it was telemedicine, is I would tell people take a half a teaspoon of baking soda, put it in 2 ounces of water, and drink it. And if that settles down your heart racing, then this is coming from GERD. This is coming from acid reflux. And if you think about reflux, it's starting in your stomach, but if you come up this high and it starts bothering you, what's right there? Your heart. And so many times that's your heart racing. Goes a little higher, you get that dry cough from the fumes. You go a little higher and you got a hoarse voice. And until you're upright long enough, then your hoarse voice will come to a clear voice. And many people only recognize reflux as it's something in their mouth, that acid has come all the way up. But those are all symptoms of reflux on its way up. So one of the stories, a case study that I'll tell, is of a patient in her 40s. Her husband had lost his job. She was now the breadwinner of the family, and she woke up in panic because remember, that's one of the 4 hormone groups is your cortisol. She woke up in panic and her heart was racing. So her husband was just panicked. Oh my God, she's the breadwinner now. If we lose her from a heart attack, we won't have any income and we'll be bankrupt and blah, blah. So he took her to the emergency room. They, of course, did their cardiac stuff and said, well, we don't find anything, but our testing is equivocal. So you should really go have a cardiac workup. So her husband goes, that's it. We're going to Mayo Clinic. Well, they arrive at Mayo Clinic, do an entire cardiac workup on her. The cost is $100,000 to do a Mayo Clinic cardiac workup. And in the very, very end, when they were meeting with her and her husband, you know what they said to her? Well, we're going to check your hormones now because we really think with everything in your heart showing that you're in really, really good, healthy shape, now we're going to check your hormones. It's like, wait a minute. Why didn't we do that at the same time so we could have actually negated a lot of this very expensive medical cardiac workup? But no, medicine isn't about wellness these days. It's about sickness, and it's about profitability and what hospitals can make per patient, per testing, and how many tests they can do. And it's a travesty. But to your point, Dr. Claire, it's not the family medicine approach out there anymore. It is the big corporate, how many procedures can we do approach, and the patient is actually left in the dust on the wayside.
Yeah.
So sadly true. Absolutely. And Bridget, I'd love you to weigh in on this too, in terms of from your perspective as a scientist and energy worker, symptoms that you see.
Yeah, I had the heart palpitations as a side effect from Synthroid that I took for Hashi's. And I'm telling you that's the most uncomfortable feeling you can have when you're just doing whatever and all of a sudden your heart just starts palpitating. I freaked out. I'm like, what's happening? Went into fight, flight, or freeze. Back then, I didn't know that this was what I was doing and making the situation much, much worse. So now, I'm not on any medications. I take care of myself. But for those out there that have any type of heart issues with Jin Shinjutsu, just holding your little finger, it balances not only your small intestine, which will help with the GERD, but also your heart energy. system. So just simply holding your thumb or your little finger and taking those breaths.
Really?
So important to
Just
breathe.
this? Just
Just
this.
this.
And how
Just
long
this.
do you take? How long do you breathe for?
I do 2 to 5 minutes. That's what when I later on, when I started doing this practice, when I had the heart palpitations, eventually I would just go like this. A second later, they would go away because I was so in tune with my body. But back in the
Interesting.
day, symptoms, I didn't connect it to. I was so disconnected from my body. So you really have to be in tune with your body, and meditation's a great way to kind of center yourself, ask questions, and get to know yourself again.
Does it matter which hand?
No, it kind of does. I mean, your right hand's the present, your left hand is generational past trauma. So I always do both. If it's something current, I do this. There's a whole thing
Yeah.
on just on the hand holding fingers that we can go through all the organs. But
Oh my
very-
goodness. So much cool information. Before we move on to our next question, let's take a little physical stretch break. Everybody stretch. Bounce up in your chair if you want. Do something that makes you feel good. Take a yawn. It's always good. I know I've been sitting for about an hour and a half now. Shake it out. Do what feels good to you. Take a sip of water. Hydration is really important. Oh, and we have another doctor coming. Shahrazad. She was a doctor in Iran. And now she lives in Canada, cannot practice, but she's doing science. So welcome, Shahrazad. Oh, let's talk about risk factors.
Hi, thank you.
Hi, so glad you're here.
Thanks. My meeting just finished. I'm happy.
Okay. So let's talk about risk factors. What are some of the risk factors as we age, and is it different between men, women, and people who identify as non-binary? Bridget, why don't you start us off?
Okay, I was going to pass this to
Oh,
the doctors.
You can pass it if you want. You can pass it.
I would prefer that. Thank you.
Okay, perfect. So, Dr. Vicky, start us off.
Well, one of the most important things from a risk factor standpoint, I think, is some of the basics you hear all the time. Where is your blood pressure? Where is your pulse? What is your lifestyle? Are you doing 30 minutes of even very mild exercise a day? That could mean walking on a treadmill. That could mean walking in your neighborhood. In my world, what I would counsel my patients is, even if you're a very busy person, 5 minutes of stair walking can equal 30 minutes of straight, flat walking. And I don't mean stop and start on the stairs. I don't mean jogging the stairs. I mean 5 minutes of continuous up and down stair walking. So some simple lifestyle things that go into that. But again, I've mentioned the 4 main hormone groups in the body. All 4 of them are talking to each other and have potential risk to the rest of the body, and especially to that circulatory system, your heart. So your female male hormones, for guys, it's your male hormone. Your cortisol, your stress. And golly, who doesn't have stress, right? Your third hormone is your thyroid, and that includes whether you make antibodies like Bridget with her Hashimoto's. And your fourth hormone is your insulin. I didn't say blood sugar. I didn't say A1C. I said your insulin. And knowing if you have a potentially insulin resistant picture, that can come with hormone imbalance, even as early as your teens, if you have potential polycystic ovary, or if you have an endometriosis situation, or fibroids. Those are all estrogen dominant situations that make you prone to throw the other hormone groups in your body off. So know that your heart doesn't live in a vacuum. Your heart has to send circulation to your entire body. So the state of circulation in your feet, if you are on your feet, you don't support circulation by compression stockings, or if you notice you have swelling or sock marks when you wear stockings, those are all signs of quote unquote overwatering your legs. Think of overwatering a plant. What happens? It dies. Well, you can kill tissue in your legs if you overwater your legs, if the circulation isn't good in your legs. So every woman who's ever delivered a baby is at risk for varicose veins. Any guy who does any kind of work where he's standing on concrete all day is at risk of damaging his circulation in his lower legs. So these are just some of the very, very simple things that even when just meeting a patient for the first time, asking their occupation, checking hormone levels, checking their stress level, those are all things that you can easily do. But in my world, I stressed those 4 hormone legs of a chair, because if you sit on a chair with a broken leg, guess what? You're on the floor and you don't even know how you got there. So you have to have balanced hormone groups in your body.
Thank you, Dr. Vicki. Dr. Claire, risk factors as we age, men, women, non-binary.
I think Dr. Vicki's put it together very, very well. I think in our understanding, lifestyle is probably one of the most important things that are there. And I know you're going to get into that later with nutrition, but making sure that the physicality is functioning the best way it possibly can. But I think the biggest thing, and Dr. Vicki alluded to that, is the stress. Like our adrenal gland is very, very important. All the other hormones, if the adrenal's out, thyroid's out, but it's also the first gland that's affected, by stress, and so we're not able to necessarily make the hormones the way we're supposed to be doing because of that. But so many people are so used to being in a stressful situation that they're not even aware that they're there, and so they raise their baseline of cortisol, sympathetic nervous system, fight or flight kind of thing, to the point where it's up there pretty well at all times at a subconscious level, and then all of a sudden something happens that throws it out. So it's if you look at an animal that's being chased, if they manage to survive, 20 minutes later they're peacefully eating. But that doesn't happen with us. It stays up there, so it doesn't take much to continually fire off that cortisol, the adrenaline, all the other hormones that are having that sympathetic nervous system overdrive on our body, and we're not into parasympathetic, we're not into the balancing, and so the body is just being inundated with it. So it's a way of saying, okay, well, I'm handling the stress, because I seem to be okay, because all of a sudden something's going to happen, like it did with Bridget, that all of a sudden the body's just going to say, okay, I can't do this anymore. It's a matter of saying, okay, what's happening to me and where am I at? And are those palpitations, are those feelings in here an indication that my body is telling me that there's something here that's going wrong, and I don't want to wait until I have the heart attack or have something else. I want to find out about it at the physiological level.
And Dr. Claire, is there a difference for men, women, people who don't identify as either? Or is it just, we're talking generally speaking about hormones?
I think, generally speaking, I think men have a tendency to hide it more. It's not very macho to mention that you've got some issues or you can't handle the stress, etc. But the body is still going to be reactive. But I think again, for the women, to the hormones are actually more protective, for them as well too. So, but it's just a matter of being aware of yourself, as Bridget said. Know your body, know yourself, not in the sense of what's wrong with it, but okay, how do I do better here?
Fantastic. Dr. Vicki, do you have any comments about the difference among the genders?
No, it's just realize that, the importance of knowing where your hormones are. So in women, you have to know not just your female estradiol, progesterone, but your total free testosterone. Those 4 have to balance. In guys, you make a little bit of estradiol, progesterone, but really in guys, it's your total and free testosterone. They're just as important to know and need to be age appropriate. Many guys have no clue that there is an age appropriate amount of testosterone that they should have. They just think if I perform in the bedroom, I'm doing well. But it has so much more to do with every body system in the body, not just their performance. So equally important, women and men.
Fantastic. Thank you. Now, early diagnosis. We've been talking about some symptoms. We've been talking about risk factors. We've been talking about what it is, heart health and hormones and how it's all related. What does early diagnosis mean? And how can we approach that? Bridget, do you have any comment on this one, or do you want to leave that one for the doctors as well? I leave that up to you.
Yeah, because of the early diagnosis, I only talk about my own self, and basically you need to take care of yourself as soon as you can before menopause, before you get sick. It's not natural to be sick or diseased. It's unnatural. So just knowing yourself and doing the work now, today.
Perfect. Thank you. Dr. Vicky.
Well, one of the easiest things, again, that you can do with anybody of any age is, what is their resting heart rate? Are they short of breath walking across the room? As they walk into your office, or they walk from the waiting room to your consult room, what are you observing on that patient? And if you're observing that they're short of breath in that 10-foot walk, we've got a problem here. And they're putting undue stress on their heart. Now, maybe it's for various and other reasons, but that's a cardiac issue first, and it's going to keep them from being active. Then your blood pressure, whether it's pre-activity, post-activity, those are all things that can give you an idea as well. For a lot of people, though, cardiac risk can start with insulin resistance, and they don't even realize they may be. Many women get tested for gestational diabetes when they are in their childbearing years, so they at least have a clue that they may be prone to it. If you have a family history, that may be helpful, but realize people 20, 30 years ago ate differently than they eat now. In some cases better, and in some cases not so better. But realize that, a 42-year-old guy that walks into your office who looks buff and fit says to you, I started having shortness of breath when I did my third lift. That's a problem. This is a buff guy who's in the gym who's telling you this is a change that he's at least noticing is different enough to tell you, but he doesn't know what it means. Well, right. When I sent him for a calcium score, a CT of his heart, he had 5 out of 6 vessels that were looking more than 90% blocked. And I sent him right to the cardiologist. There are different ages and stages of symptoms that you will see. Women who have a difficult high blood pressure pregnancy or toxemia may put such stress on their heart that postpartum, they may sound like they're a typical mom postpartum, but they can't walk across the room to pick up their child to breastfeed. So there can be some very, typical signs that you have to be aware of as a healthcare provider, but even as yourself. This isn't normal. And if you accept this as normal, then you may be putting yourself at risk. So there is risk in 20-year-olds and 30-year-olds and 40-year-olds. In the adolescent population, cardiac risk can be something like a reopening of a hole in your heart that closed at birth. So sometimes athletes who push their body will reopen an area, a hole in their heart that suddenly puts them at risk for a fatal heart attack with exercise. So hypertrophic heart disease, athletes who build such increased muscle in their heart that when they slow down to just normal activity, their heart is so thick that it can't let normal blood flow out. Yeah. So there are unusual circumstances, but we're at cardiac risk starting in our adolescence and going forward, just different ages, different stages of cardiac disease.
Thank you, Dr. Vicky. And I'm imagining even in the last few years, we've seen even more incidences of those, but we won't go there right now. Dr. Claire, early diagnosis and what you're thinking and meaning.
Well, I think everything that Dr. Vicky and Bridget have said is important, but I think the other thing is just looking at the general body. When we're looking at physiological changes before they turn into pathology, and that's the case of being attuned to our body and sort of saying, okay, here's a physiological change. I've moved from balance down to the physiology. Now what I want to do is get myself back up to balance again before. If I don't do that, I'm going to go down to the next stage to pathophysiology, etc. But one of the biggest things is inflammation, and inflammation is in our books as the chronic. It's the source of all chronic diseases. and the heart is very, very susceptible to that. And that inflammation can be what we call silent inflammation, where you're not aware of it until all of a sudden something happens cardiacally. So you need to look at the inflammation. There's the tests for doing that, a highly sensitive CRP and other tests as well. But saying, okay, have I got muscle pain? Have I got, have I got indications, arthritic symptoms that are showing up that suggest there's inflammation going on in the body? And working on that instead of waiting until you end up having something showing up cardiac wise. And a lot of it's got to do with intuition, as you know, Vicki and Bridget. We develop an intuitive sense of our patients, and we can see that there's something different there. And we had similar thing where we had a patient that was coming in, and he just seemed to be off. Skin color didn't look that good. He had gone to a regular family doctor, and they said, no, nothing you need to do. So we sent him off for a CT angiogram, and he ended up 2 weeks later having quadruple bypass because of how things were blocked in. But that's that case of sort of looking at the whole picture and not being pigeonholed into one particular part of things.
Right. Well, right. And something else I wanted to just quickly bring up is many times people would say to me, well, Doc, my heart is fine. I just had an EKG and they told me my heart is healthy. Yeah. And what I always want to impress on patients is I want you to think of your heart like a house. And your house has many systems that make your house work. Well, so does your heart. So if you think about your heart, you've got the walls of your heart, the muscle. Well, that's like the walls of your house, both inside and outside. Okay, they have to be healthy. You can have a tree fall down, hit your house, that kind of thing. Secondly, you have plumbing in your house. Well, the plumbing is the vessels that go around the outside. Those are the ones that get looked at for, do you have any blockage of your arteries? But you also have vessels on the inside. So it's your plumbing, and your plumbing clogged or not. Do you need liquid plumber for your heart, so to speak? A stent.
Please not.
Please not. Thirdly, you have an electrical system in your heart, and that's your pacemaker. It's the pace that your heart goes at. That's what your EKG is looking at. And if that pacemaker is running out of juice, and we all think of, and we hear about house fires that happen when electrical wiring goes bad in a house because it's old. Well, wiring can go bad in our heart too, and we can go into atrial flutter, atrial fib. That next pacemaker, next man up, may go faster than your normal rate. It may go slower. It may go similar. But that's your EKG. That's only looking at your electrical part of your heart. Then if you realize you have valves in your heart, those are the windows that open and close in your house. They can get foggy in your house. They cannot go down well, and you have leaks. And so realize that there are multiple systems that make your heart work. So when you have an EKG, realize you're only looking at the electrical part of your heart. There are so many other parts of your heart that give you heart health.
So great. I love that metaphor, Dr. Vicki. It's phenomenal. And I'm looking at the time going, oh my goodness, there's so much more to say. And there's some fantastic questions in the chat, which we will get to momentarily. But let's combine some best practices, lifestyle and nutrition. And let's just talk about that in relation to heart health. And just before we jump in, if we're going to become our own best health advocates, we have to become aware of our bodies. And most of us have lived from here up for most of our lives. How do we bring our whole bodies and our awareness and all of this into it? So Bridget, can you kick us off about some best practices, lifestyle, nutrition, etc.?
I would love to. These are two things that I love to talk about. Lifestyle. Our bodies are not meant to sit at a computer for 8 hours a day. Our bodies are meant to move. If we don't move, then we're going to have other problems like inflammation, congestion, all these other things. So your lifestyle, you need to really look at it to say, hey, and if, use technology for the good. Put a timer on your phone and have every 25 minutes get up and move. It can be fun. It's energizing. You can really do really good stuff. I put my timer on, walk to the other side of the house. I'll dance, I'll sing, I'll move. I mean, be 5 years old again, have fun. It's just a walk, but make it yours. Nutrition, the food that we have today, as opposed to 100 years ago, the nutrients in it, completely different. Even if you take an organic apple today compared to an organic apple 100 years ago, 300 years ago, it's, I don't know, like 8 times weaker or less nutrients. So we must be aware about that. And I'm not saying you got to go out and eat, all this kind of stuff. Organic is a must. They did a study recently where they took 2 families for a week. You could eat anything you want. They got all the pesticides, normal food. The other people, purely organic. The pesticides in their bodies went down to like minimal within 1 week. I know
Wow.
it's expensive, but so's going to the doctor, so doing the pills. That didn't work for me. So, and they don't find the root cause. I wanted to find the root cause. What is wrong with me? And it's not always one thing. It's many things. We are a system. We have more DNA in us that's not human. So we need to understand that. So nutrition, and another thing with nutrition, eating 3 meals a day, what is up with that? The breakfast being the most important meal, that was a whole Kellogg's campaign in the 70s. We've been infected and programmed with all that, crap. I just did a 3-day water fast about a month ago, and I was amazed not only how easy I was able to do it, but I had the tools, and just my body, how different it changed. I'm like, I knew about water fast. I didn't really want to do it, but if a simple 3-day water fast can really change the body, why not do it, and make it your lifestyle? So do what makes you feel good and happy, and rinse and repeat every day.
Love it. Rinse and repeat. There's there's our motto for today. Find something you like that works and rinse and repeat. Dr. Vicky.
Well, I want to echo the whole pesticide thing. What a lot of people have zero idea of is that in this country, we allow DEET and many of the other pesticides to be used. Now it's glyphosate, which is Roundup. And, what I would dare say most practitioners don't even know is that DEET has been permanently incorporated into the wheat seed of the wheat in this country. And because the US was so late in banning DEET from farmers' fields and agriculture, it is a permanent part of it, and we cannot get it out of the wheat seed. So we eat DEET every time we eat wheat, and that's where a lot of Hashimoto's comes from. Is not from a wheat sensitivity, it's a DEET sensitivity from the wheat seed. I have a daughter who's a PhD in nutritional sciences. There are actually wheat seed repositories around the world that have pre-DEET wheat seed for study. That's hard to say fast. And that's where they're doing the original research on wheat seed, and know that many people who have trouble with wheat in the US can go to Europe and eat wheat just fine, because they banned they banned DEET in Europe so much sooner than they did in the US. So our FDA has been almost anti-health to our food chain and the health of our food, the integrity of our food. And I so agree with Bridget. The food quality in this country is so bad, the FDA will not even decrease the sugar requirement of the high level of sugar. They won't even drop it by 5 grams because it will hurt big industry. Wait a minute. What about hurting the health of the population? Oh, no, that doesn't count. We would hurt the McDonald's and the Burger Kings of the world. So we just won't do that. So realize, yes, organic is good. There are places that you can actually order wheat seed from Europe or even from some American truly organic farms that they've tested through universities, the amount of DEET that's in their wheat seed. So I totally agree. The nutritional part of things is huge, 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 huge. And, I'm a fan of never doing relative intermittent fasting, but not regular intermittent fasting. And the reason I say that is that if your body goes more than 12 hours without eating, you will break down muscle. You don't break down fat. That's what we want to have happen. We break down muscle. So for everybody who goes to the gym to build muscle, if you don't eat in 12 hours, you're breaking it down. Build, break down, build, break down. That's a do loop that takes you nowhere. Okay. It's called insanity. You're doing the same thing and expecting a different result. So always make sure that if you are having your meals, never be more than 12 hours apart. You train your body to become diabetic.
Interesting. Oh, we could talk for hours. Dr. Claire, if you could answer this one, and then I'm going to do a quick presentation, and we have so many other questions to ask. So what's your thought on this?
Well, and the perfect analysis of both Bridget and Dr. Vicky with this, because what we take in is how our physiology is going to function with that. So that's the important thing. A couple of things that are simple is stay away from processed foods. For one thing, don't eat anything processed because it's all full of chemicals. And the other problem with the chemicals is often they were studied separately. They weren't studied in a conglomerate. And so that we're getting many, many things with that. So that's the one thing. Staying away from refined sugars as well too. The high fructose corn syrup, because all of that is a huge impact on the body, including that pre-diabetic or insulin resistant, kind of picture that's there. Doing the kind of exercise that allows you to break down the fat. So that you're able to then get rid of that insulin resistance part of things. Looking at inflammation, but knowing that how our body functions is epigenetics. We are born with the genetics, but that's only a very, very small part. But epigenetics is how our body is going to respond. And with the work of Bruce Lipton, it's either going to be in a proactive, positive, healing way, or it's going to be in a protective, negative way. And so that's the part on the physicality, but also knowing that epigenetics also works mentally and emotionally and spiritually. So we have to make sure that we provide the right pattern to the body from the top, and that the body then go respond to that. And our mind is our interface. So we either have the opportunity of having the mind regurgitate or mirror back all of our programs and our negativity, and our body's going to react to that, or we can allow the mind to allow the divine perfection come through to us, and our body is going to respond to that as well too. So we just have to remember that epigenetics is it's a whole picture. It's not just our physicality.
Oh my gosh, what a fantastic conversation. I feel so blessed. I'm going to share my screen very briefly here, and then we'll come back to some wonderful discussions. And the reason I'm doing this is because we want to keep these conversations going. And I'm just so grateful for a year of these conversations, and today's about heart health. Who knew? We hear heart health everywhere, but are we really paying attention? Are we so inundated with it? So our next conversation is going to be about bone health and pelvic health. And again, I think it's one of these conversations we don't really talk about unless we're talking about osteoporosis or calcium. I believe there's so much more to the issue. So we're going to be talking about some of these amazing aspects of it, and cognitive health and bone health. How are those connected? I don't know this yet, but I know that some people are going to be talking about it. And Dr. Vicky will be returning with us for that conversation. So that's going to be on September. No, don't make the year go faster. March 22nd of this year, same time. And if you entered your name today, you will be entered into a draw for 2 phenomenal options. And I'm going to show you. I'm going to be sending somebody this wonderful white, luxurious faux fur blanket. That's one thing, and it's an $80 value. And then another, I have a beautifully packaged up, engraved 2 black mugs that are matte finish on the outside and beautifully glazed on the inside as well. And anywhere in the Canada or continental United States, can't do Hawaii, sorry, it's just too much. And then, of course, Bill, who's one of my sponsors, And my partner in life will also offer a 1-hour coaching session, which is phenomenal. And my sponsors are the Gift Basket Co. and Spread to Love and Brandon Inc. So I would love for you to do that. The link Wendy has put in the chat by now. If not, it'll be there very shortly. And one of the ways that we want to keep Mind Myself going is to take us to the next level. And we've managed to do some incredible things over the past year and a half that we've been live in the last year of events. And if you would like to support that, we would welcome your donations. Other places that are very worthy for donations, Blind Beginnings. It's a local charity that helps families who have children who are blind or sight impaired. And then another organization that's in Africa, I believe this one is it's in Uganda. There are so many girls there who do not have adequate period products. And if you have any inclination to support any or all of these, we would welcome it. And we, of course, want to stay connected with you. I have a Myndful Health survey, various places throughout the Mind Myself website, and we want to know, what do you want from us? So we'd love for you to fill in that survey if you haven't done it. Visit the website, sign up for our monthly Mindful Moment, and keep the conversation. And of course, we have our social media. So that's it for now for that. And we are going to get back to our fantastic conversation with, there are lots of questions here, but let's do this one too. How can we best advocate for ourselves and our loved ones around heart health? Dr. Vicky, can you start us off with that?
Well, the first thing I tell every patient, regardless of age, they walk into my office is, do you have a home blood pressure cuff? And it sounds like something only, quote, old people should have, but we all need to be cognizant of what our pulse and our blood pressure are, what it is in the morning, what it is in the afternoon, what it is in the evening. Get an idea of how your body functions from a circulatory, standpoint. And then if you are a runner, if you're a desk jockey, if you're a weekend warrior, those are all different stressors on your heart. And you need to know how your heart and circulatory parameters are going to work for you. And again, if you go out to take a walk with your husband, women in your 30s or 40s, and you're out of breath, but he's 10 feet in front of you and coming back for you all the time, that's a problem. So, realize there are some of the early signs and symptoms that we've talked about. Shortness of breath is one, heart racing is another. Know your hormone levels. I will always say know your hormone levels. But you also have to know what are some of the simple parameters you can do. You can check your pulse in your neck. You can check it on the thumb side of your wrist. Don't use your first finger. You have a pulse in that finger. Use your second or your third and your fourth fingers. And find your pulse, count it for 10 seconds, and then multiply it times 6. If you exercise and you're feeling heart racing, check your pulse. If it's regular, it's usually just going to be a regular rhythm. If it's irregular, there may be something going on with your wiring in your heart, and you may need to see somebody about what's going on. So there are some simple things you can do. Know how to check your pulse. Know that you have to have adequate hydration in your day. If you do a lot of physical exercise, thank you. Thank you, everybody. Take your drink. If you are not replacing, and I would tell my patients, for every 64 ounces of water, 16 ounces of electrolyte. You must respect that you are utilizing muscle, and muscle with electrolyte loss is not going to work very well for you. You're actually going to get cramps. If you do all water all day, you can water intoxicate and get headaches and swell your brain. So too much of a good thing can be too much. Balance. It's always about balance.
Thank you, Dr. Vicky. Bridget.
Yeah, your superpower is really to know yourself. And with the practice of Jitsu, it is a practice to know thyself. And just simply having 10 minutes a day, I do at least 4 hours a day of self-care. But that includes sauna, walking, grounding, all that kind of stuff. But you must be your best example for your children, for your grandchildren. I don't believe that when we get older and seasoned that we have to age. I'm all about anti-aging, and with the knowledge and the frequencies and the technology that's coming out there, there's no reason why we can't anti-age. I mean, with my hair too, I'm gonna get brown, get dark eventually, but right now this is what's happening. So, taking time for yourself, loving yourself is not selfish. It's what's needed to do. And I think as women, especially, we've kind of lose that when we're raising our children and we're having our career, and we're taking care of our husband, house, and all that stuff. And we get into that rushing woman syndrome. And that's what happened to me. I was taking care of everybody else except for me and watching my health go down. And I thought I was failing. And I just didn't understand my body, what it was saying. It was screaming at me with all the symptoms with Hashi's, but I don't know. I just ignored it. I thought, well, it'll go away, or, but you have to be your best advocate for yourself. And then when you're your own example, you can share it with others, and then they can, check out what you do, and we can change the world. I really do believe this.
Thank you, Bridget. And just before we get to Dr. Claire, I know I have a technology that Bill and I are using, and literally my hair is going darker. And I can see it almost daily. It's changing. If you look at some of the older videos, there was more white here. Not to mention other things, but I totally agree, Bridget. That's so awesome. Dr. Claire.
I think two things. Number one, be a mama bear. All of these things that Bridget and Dr. Vicky are talking about are pointing us to that there's something that's there. But what happens, unfortunately, is people say, "Oh well, there's nothing in it," or "you're getting old," or whatever it is. So, moms know when there's something wrong with their kid, even though the doctors say, there's nothing wrong with them, or it's just this. So they have to behave to support their kid and look after it. So we have to do the same thing. We have to be a mama bear in our actions for our family if they're not capable of doing it, and also for ourselves. And I think the other part is live above the line. As far as our emotions are concerned, we talk about that, but live above the line, because above the line is growth in our body. Below the line are emotions that are detrimental to our body. So the more we can do that and be above the line, and if we know we've got programs, work on them in a way of freeing them up. And that's one of the reasons why we love homeopathy, is because it gives us that opportunity at the high potencies to free ourselves from those programs so that we can live our authentic best self.
Thank you, Dr. Claire. And I just want to put in another plug for Dr. Claire here. Bill and I have just started, we're about 3 weeks into a heavy metal detox homeopathy cleanse. And so we're taking lick sprays twice a day, and there's a protocol to do it. And then our little pellets 45 minutes later. And so I've never done one, but I know that this is cool. And that's one of the things that he and Carol are making available to the world. And it's just so awesome. Plus, if you have any injuries due to any jabs, that's one of their specialties in homeopathy. So we won't go there right now. Questions here. From Chelsea, what's your opinion on low dose hormone therapy before women reach menopause, and on the efficacy of extracts like maca, rhodiola, ashwagandha as modulators of premenopausal symptoms? Vicky, let's start with you, Dr. Vicky.
Thank you. Well, again, there's a bell curve of where your hormone should be. So low dose hormone, that doesn't mean anything unless you know what your low dose is doing in your body. So in other words, in that graph of what happens to women in their perimenopausal years, which could be as early as starting at age 35, believe it or not, it's when your symptoms of hormone swings start happening for you. Some people never have any, but the medical definition is the year before menopause. Well, what a stupid definition that is. There's nothing.
Tell us what you really think, Dr. Vicky. Tell us what you really think.
It is so stupid. There's nothing you can hang your hat on about when is that. So it's different for every person. But low dose hormone doesn't tell me anything about what it's doing for your body. So you have to know, are you still on the curve? And are you still balanced with your estradiol progesterone? Are you still balanced with your female male? That's only one leg of your chair. but is that impacting what your thyroid is doing? Is it impacting what your cortisol is doing? Is it impacting what your insulin is doing? That's the bigger question to ask. And that's why I actually wrote my books. And so at least know that there are resources out there that you can look at, but it's not just, is low dose okay? It's, what is it doing in your body?
Thank you, Dr. Vicky. Either Bridget or Dr. Claire, any comments on that?
No, I think, yeah, I think just age appropriate, bioidentical hormone replacement, not just one size fits all.
Absolutely. Mm-hmm.
Great. Okay, fantastic. And we haven't talked about maca, radiola, and ashwagandha, but I would suggest that all of those things should be used in conversation with your healthcare practitioner, whoever that is. And if you don't have a doctor, perhaps you could make a consultation with one of the doctors here or another one of the practitioners on the Mind Myself website. I know I don't have a doctor. I'm in BC and I'm one of the 1 million out of 5 million people who do not have a medical practitioner right now or a doctor. And so it's tricky, but there are ways we can do this. Let's go to another question. Do you have any recommendations or opinions on wearable vagus nerve stimulation devices like AmmoFit S or Sensate? I think I'm getting to activate the parasympathetic nervous system to balance. Anybody have a comment on that?
I would realize your vagus nerve you can stimulate along the left side of your neck. Okay, not the right side, but the left side. Okay, and it's going to go all the way down to your stomach. So if you want to stimulate your vagus nerve, you simply have to go underneath the
jawbone.
Well, not the jawbone. You're a little too far forward, but you know, right underneath your behind on your I'm blanking on the name of it, behind your ear, that bone right back there. And just go just below it and start to do one side only massage, and you're going to stimulate your vagus nerve. The other thing is, if you're doing it for GERD, take a half a teaspoon of baking soda and 2 ounces of water and chug a lug, and you're going to have your GERD symptoms. They're going to settle in 2 minutes or less. And what's wrong with 2 minutes? Nothing. This you can do while you're driving your car. And it's very simple. Don't do both sides at the same time. You'll pass out. You may knock blood flow to your head out. Not a good plan, you know. But left side only, do that massage. And you're going to find yourself calming your vagus nerve down. So why work with an expensive implantable that's letting technology override your body? Realize how your body works and how you can work with your body. Breathing, techniques, again, something you can do when you're driving. So there are any host of things that if you're aware what your vagus is, where it is, how you can self-stimulate it, then you're already ahead of the game.
Thank you, Dr. Vicky. Bridget, I know you have something you want to say.
Yeah, I don't believe in buying products. Your body knows how to self-heal, self-regulate. You use your hands and you touch your body. So I do something very similar, but energy work. I don't push hard on my, it's light touches, and you can actually play with your earlobes, pulling them around, pushing them around. Actually, this helps where any neck issues you might have because of the congestion, but this actually helps stimulate your vagus nerve. Another one is holding your hands like this, then taking a breath, rooting it down here to your temples, both sides. Then coming around back here to your occipital groove, holding your neck. Again, breathing the whole time, and then coming down here and holding your chest and breathe. It will activate your vagus nerve, and you can tell because you'll feel this kind of settling, but yawning, eyes tearing, nose running. These are all signs that you're in the parasympathetic state, as well as gurgling in your stomach. When I'm doing a Jitsu session with a person, they always apologize. Oh, I'm so sorry, because the noise that their stomachs are making is crazy. But I'm like, that to me is what I want to hear, because I know that body is in that parasympathetic state. So seriously, touching your body, holding, especially your heart, and just telling yourself I love you. Do the Ho'oponopono. I love you. Thank you. I'm sorry. Please forgive me. I mean, say it. They're very healing words. It's a prayer. You must take the time. Don't be like me. Learn from me. I had 8 years of Hashi's hell, and it's because I wouldn't slow down. The doctors told me, oh, you're stressed out, you're this, you're that, take these pills. And I wouldn't believe anything, that they were telling me. So you must know and understand your body and love your body, because it's the only one you have.
Thank you. Dr. Claire, do you have anything to add to that?
Yeah, I think the breathing is like all of those things are working as well. But the one thing with the breathing that's sometimes in our understanding misunderstood is that if you breathe fast and shallow, you're going to be pushing sympathetic nervous system overdrive. If you breathe very, very deeply with more out breaths than in breaths, then you're going to end up with parasympathetic nervous system overdrive. But if you can do an equal breath, like 5 in, 5 out equally, and thinking about being in a higher frequency when you're doing that, then that's going to put you in parasympathetic and sympathetic balance. And your vagus nerve is the one that's primarily involved with parasympathetic things. So you just want to make sure you're giving your body the right message. You're not sitting there thinking, okay, is this going to work? Is it working? Am I feeling better? No. Yeah. Concentrate on the breath in, concentrate on the breath out, and the balance of 5 in, 5 out, or whatever works for you is the. And then again, heart math techniques are again ways of helping you to get into that balance as well.
Thank you. And we have some other questions, but I see in the chat, someone said, Christine said, can you recommend stress management that does not take time and money? Well, you've just all explained some. And I actually, even with that little bit of stimulation that I was doing it with you, Bridget, I can feel the flow in my neck and head. That's so different right there. And taking the breath. Yes, indeed. And there are tools, and we are going to continue having more tools that are free and available on Mind Myself. There are tons of blogs you can look. There's breath work. And Bridget, you and I need to do another one on that kind of thing right now too. So there you go. Another question is, if your cortisol this is from Jen, if your cortisol level is low, are there natural ways to bring it up? My uninformed opinion says, I'm not sure how it could be low because we're in so much stress these days. Cortisol is flying, but please answer. Dr.
Well,
Vicky.
a low cortisol, if you are out of the reference range, okay, there's an optimal range kind of in the middle. But if you're too low, you're in distress. If you're high, you're in stress. So you can be in stress, be so stressed that you fly all the way through the normal range to distress. And what I would find in distress patients is they wouldn't respond to a methylated vitamin B complex. Realize methyl vitamin B12 is one of the best things you can do to support your cortisol and your adrenal. But if you are missing a genetic, one of the genetic markers, MTHFR, if you're missing 1 or 2 of those genes, then you cannot properly support your adrenal, and you need the methylated vitamin B complex, both methyl B12 and methylfolate. But when you're low, and I'll give you an example, I had a 19-year-old 23-year-old. She was just finished college. She was a biomedical engineer, very high powered, starting at an entry level job. And the job she was in, as people would quit, they would take and dump all of their work on her desk. Well, she was a clean desk girl. So she would stay late, and then she would go in on Saturdays to get the work done because she was a clean desk girl. Well, finally her fiance said, enough. This is crazy. You can't stop. The work will be there tomorrow when you go in. Well, her boss came down on her. And so I get a phone call. It's the grandmother going, I don't know what's going on, but you need to see her today. Okay. So they bring her in. And she is just like a cat on a hot tin roof. She can't sit still, can't sit still. And I said, what's going on with you? And she just kept, and for 5 minutes, and I let her alone, she just was, her phone went off, and she literally picked up her phone, and oh my God, and she's texting back and forth, putting it down. It goes off again. Oh my God. And she's just doing this for 5 minutes. And so finally she stopped and she looked at me and she whispered, help me. And I thought, oh my God, she's in distress. So I literally, you can't at that point put vitamin B12 into somebody and say magically they're going to be fine. I literally, she couldn't function. I said, do you know what day it is? She goes, it's Saturday. I should be at the office. Well, no, it was Wednesday. And her grandmother was sitting right there, and she said, well, let me put a little more perspective on this. She packed her bag and said to her fiance this morning, we have to be at the airport. Come on, we're late. And he's like, no, we aren't going anywhere. Yes, we're on our trip to such and such, and we have to go. We're going to miss our flight. And he's, no, that's in 4 months. You're wrong. So this isn't August. This is March. No. And she literally was completely unable to stay in the present moment and function. So I had to admit her to a psych hospital for evaluation because there was nothing I could do short term that was going to pull her out of this. But she had allowed things, her stress, to get to such a level because of her belief of clean desk that she just literally drove herself into such distress she couldn't function.
So hopefully people listening to this will address it sooner. If you feel like that's happening, then talk to your practitioner, perhaps use a B complex. Dr. Claire.
And when you're in fight or flight, all you see is what's in front of you of how you're going to survive this particular moment. You don't have the awareness of what else is going on around you. And that's why, because of in that sympathetic nervous system overdrive, if you don't survive this moment, it's game over. So, don't worry about your trip in 4 months because you're not going to be here anyway. So that's why we have to be aware of what's happening and then allow ourselves to get out of that continued stress-related fight or flight pattern so that we can then sit back and have a greater awareness of what's going on around us. And a result of that greater awareness, then we are going to be able to function in a more authentic way.
Mm-hmm.
Bridget, do you have anything to contribute on this?
I'm good.
Okay, great. Thank you. We have a number of other questions. I know we're coming to the end here. Maybe if you're willing to stay for a few more, since the discussion is going fast and furious, we'll just keep going. And this is a controversial one. I'll come back to some of the others. What is the research saying about COVID and its impact on our cardiovascular system? Anybody want to tackle that?
Well, COVID is a virus. Okay, let's just say it. It's a virus. It's a very bad virus. And any bad virus is going to do its replication in your body. It's whether your body has the ability to fight it and to clear it. So if you have inflammation in your body already, now you have a very virulent, very bad virus that gets into an organ system or multiple organ systems with inflammation. Your body can't even clear the inflammation from your organ without COVID. Now you add COVID on top of it, and it's almost game over. Your body cannot handle the additional insult on top of the inflammation that you just had happen to you. And if you were borderline Hashimoto's, you're now full-blown Hashimoto's. If you were borderline something else, you're full-blown whatever that was. And, I've seen people that turned insulin-dependent diabetic where they were normal blood sugar before. And it was the inflammation in their pancreas that took them to that stage. I had people who actually mimicked heart attacks because they had such inflammation in the circulation around their heart. that they actually built up such fast, sudden, almost explosive inflammation from just the blood vessels reacting to what was going on, that you take anything that's a blood vessel and you tell it to react, it may react this way, but it may react this way. And if you come down on something that may have only been 50% blocked, but you come down on it, now you're suddenly 100% blocked. Well, wait a minute, and that's inflammation in the walls of the blood vessels causing it, not the plaque. You take that inflammation and bring it down on the plaque, and that's what triggers the heart attack. So realize, if you're walking into a situation with an inflamed body and you have inflammation, all over, you're not going to fare well with a virus, because it's going to be your body trying hard to clear it, and it's going to try so hard that it may actually cause more trouble than the virus in addition to the virus. So,
Thank you.
yeah, you have to be healthy.
So proactivity, key here, people. Become your own best health advocate. Deal with this stuff. Dr. Claire.
Yeah, I think that well said, and that a lot of it, and we found this in our experience with working with people, comorbidities are so important. They either get exasperated, accentuated, or just add to that, because you don't have a comorbidity if you don't have inflammation. So it fits with that. And I think the other problem with the when it's put into your body, then you're getting a big hit all at once. So it's a much more profound hit on the body. Can I say it that way?
Absolutely. Thank you, Dr. Claire. Bridget.
I agree with both of what they said. In addition, I know for a virus to live, it has to be in the right environment. Just like cancer feeds, you feed it sugar, it's going to grow. And most of our sad American diet is sugar. So the cancer's there. Now you got this virus coming in. You got to have an environment in your body that's happy, that's moving, that gets good sleep, that you put nutrients in it that's good, water. You got an experiment going on. So you got to keep that environment not available for viruses, bacteria, other things that can harm you. So happy head, happy mind. It takes practice, but it is, you can do it. I'm a perfect example of it. So the thoughts I had when I was sick were horrible. I hate my body. I hate my life. Why did this happen? Victim. Now it's like I love the fact that I got this disease, because it made me the person I am today. I mean, I've bent spoons, I've walked on water, or not water, excuse me, one day, fire at Tony Robbins event, I've done some incredible things with my body, ran a marathon, because why not? I like to challenge it. So be a good environment for your body, for yourself, so that way no viruses or anything toxic can hinder you.
Yeah, it's called a healthy terrain, and again, from all levels.
Right. I love it. And I'm aware that we're at just past 11:30. If you need to go, please do. We're going to continue this rousing conversation with a few more questions and answers. But if you have already made plans, please feel free to exit. So if you know somebody who has had an injury because of some kind of injection, let's just call it, Dr. Claire and Carol are also working on a homeopathic level with people who have those injuries. So feel free, Dr. Claire, put that information in the chat of how to reach them, homeopathy and beyond, at protonmail.me or protonmail.com. So please reach out to them if you know anybody or that you're experiencing that for yourself. Next question. I had someone, Anastasia says, I have a friend who's been dealing with spontaneous atrial fibrillation for 20 plus years and more recently diagnosed with fibromyalgia. Is there a correlation between either or both of those conditions and hormone imbalance?
I'm going to say absolutely there is, but more importantly, intermittent atrial fibrillation is again an electrical issue. So let's remember it's an electrical issue. Atrial fibrillation is going to cause heart irregularities of rhythm. So you're going to also have circulatory issues that come from it. But if your hormones are not balanced, you do not have the ability to keep your heart muscle and therefore your heart pacemaker going healthily. You may be the type of person that your pacemaker is going to go on you sooner or later, and you may actually have to, monitor what your pulse is doing. But hormone and keeping your hormone age appropriate is one of the most important things that you can do outside of having your own at home. They have these cards that you can feed it with your phone, and it can tell you what your 8-second EKG is as to whether or not you're in any kind of an electrical arrhythmia. But you need to know that your heart is in good shape, that your hormones are in good shape and balanced. You don't have stress. You've checked all 4 of those hormone groups. You don't have Hashimoto's. You don't have insulin resistance or diabetes. All of those hormone groups are hugely going to have an impact on your heart health.
Thank you. Either Bridget or Dr. Claire? Nope. Okay, got it. Next question. From Sharon, please speak to the role of genetics and heart health and risk. Dr. Claire, you got anything for that?
I think just what we said before, there is the genetic aspect, family history, that sort of thing that is there. But again, the gene is a blueprint, and what we do to that gene either activates it into a form of 1,400 different chemical pathways that put us into health, or go the other way. And that's so much, again, our own epigenetics. So that's, again, as we've talked about food, but spiritual, how we think, how we feel, what we've talked about with the sympathetic nervous system, parasympathetic nervous system. So we are not a victim of our genes.
Right. And I want to echo that it's not just with cardiac health and genes.
Yeah.
It's with breast cancer and genes. If you manage your hormone health, it doesn't matter if you carry BRCA. By also looking at the EPO4 gene for Alzheimer's, it doesn't matter if you carry the EPO4 gene or not. If you balance your hormones, and there's a whole protocol that Dr. Gail Bredesen does to reverse and end Alzheimer's, that it doesn't matter what your genetics are. So many times, again, and Dr. Claire, you said it so well, we are not victims of our genetics. Realize our genetics are something our body can read, but we have the ability to act in a way that may make what our genes say relatively irrelevant. If you follow a good lifestyle and you balance your body, take that advocacy and that responsibility for your health, then yes, your genetics may have that as a background. You may have to work harder at it, but that doesn't mean that it's a death sentence. You can overcome.
Thank you. Bridget, anything to add?
Perfectly said. The only thing I would add, you're, again, like Bruce Lipton has proven, you're not a victim of your genes. And again, like I said earlier, being the environment, what you put in, on, and around your body matters. Because you are a culture going on inside here. So if you can take that environment and the knowledge that both doctors have said and use the knowledge, you don't have to be a victim. It's your choice. I was a victim. I didn't know I was a victim. And when Tony Robbins told me you're being a victim, I was like, what? No, I'm not. I had a disease. No, I'm sick. He was right. And I had to go through that, drive down the victim lane, and it was ugly, and it was very lonely. So yeah.
Thank you. We have another question from Jen. What advice would you give someone who is told that they are at risk of a stroke or heart attack and has trouble bringing down their cholesterol? We haven't even mentioned the word cholesterol today. Who wants to weigh in on that one? And holistic, good, holistic approaches. How do we deal with this?
Well, realize that medicine, traditional medicine, looks at the lipid panel, and oh my gosh, everyone should be on Lipitor. Well, I think Lipitor is poison, personally. And I think it's one of the worst things that can be recommended to people. But I do believe that you have to know where your HDL is, your good cholesterol. And when we're under stress, that HDL can plummet. And now we have less cardiac protection. So HDL, good for your heart. LDL is lousy for your heart, is the way I would always talk to my patients. So how can you, if you're genetically prone to a high cholesterol, how can you get your HDL to help you negate your high cholesterol? Well, know that cholesterol is the building block for every hormone in your body. You have to have a minimum level of cholesterol, at least 140. You don't have that, you can't make hormone in your body. So that's a good that cholesterol has. Then you need to know you need the good guys, the HDL. You can raise your own HDL, not only with your hormone. Boy, I keep bringing hormone in, don't I? But it's true. Your hormone, both testosterone for guys, estradiol for women, raises your HDL. The other kinds of things, your exercise will raise your HDL. Your bergamot orange, as an orange in nature, it looks like a warty line. Bergamot orange, you can either get a bergamot orange and eat it, it's a little bitter, or you can get an essential oil that you can use that essential oil in your water every day. But realize stress has a major play on on your HDL. And I had to tell a patient who had started a very stressful third shift job when her HDL went from 42 to 15, 15, when the range is 35 to 60. And she was at 42 and she plummeted to 15. And I said, your job is killing you. Do you understand you're going to have a cardiac event? And the worst thing is it may happen on your drive to or back from work. So as soon as she quit her job, her HDL went back up to 42. It was the most crazy thing ever. But realize that, again, the environment you live in has a lot to do with what your cardiac health is and what you can do. It's cholesterol. We've been fed a lie for decades. What you eat has nothing to do with your cholesterol. Nothing. Cholesterol is made in your liver. Imagine that. You have to have that cholesterol. What is impacted by your diet is your triglycerides, and that's from the sugar in your diet. So learn what lipids really are for. And if your doctor says you need Lipitor, be the incessant 2-year-old and first say why. And secondly, turn around, run out of that office and get a second opinion.
Yay, I love that advice. Dr. Claire.
Just the one, that's perfect. I'm glad you brought that up about the triglycerides because they need to be low and sugars, and both sugar and inflammation are things that will put it. But when you're having blood tests done, a lot of the doctors are not aware of this. You should be doing a 12-hour fast, especially for triglycerides. But a lot of them say, well, you don't need to do that anymore. And so your triglycerides can appear to be elevated, which is then they get you onto some drugs when it's really they're not. But the sugar is so important.
And don't you think sometimes they tell you you don't need to fast so you get a high triglycerides so they can put you on something?
I think you're probably very correct.
And are you, when you say sugar, are you meaning like highly processed sugar and lots of high carbs, like simple carbs? Are you still talking about things like whole foods, yams, sweet potatoes, maybe once in a while some maple syrup or honey? Can one of you comment on that?
Well, natural sugars are in nature, so most of the time in moderation, okay? But to Dr. Claire's point, the 12-hour fast is still important. So if your body is going to clear any natural sugars that you've had in your body for the past 12 hours, it isn't going to show up on your triglycerides. So,
great, thank you. What are some holistic things? We're coming down to the last bits of our conversation here. Unless other people have some more questions, feel free to raise your hands electronically and ask your questions, people who are still here with us. What are some holistic things that we can do? I know we still have to work with our practitioners and our doctors, but what are some things we can do right now? Hearing all of this incredible information, what are some things we can do right now for ourselves that are holistic heart health things? Bridget, you want to kick us off?
Take at least 10 minutes a day for you in the morning to set your day, and at night to forgive your day, to kind of review it and take out the things that made you irritated or frustrated and kind of redo them to the way that you wanted it to be. It's kind of like a visualization. Holding each finger 2 to 5 minutes and taking a breath that your exhale is at least 2 or 3 times longer than your inhale. So if you want to inhale a count of 4 and exhale a count of 8, that would be really good. That automatically gets you in that parasympathetic state. Going outside in the morning and seeing that first sunrise helps your circadian rhythm get into check. If you didn't have a good night's sleep, at least your body will know, okay, it's time to wake up, and the hormones will start doing their cycle that they need to. So, and just really press for spending time with you, because you're the only you and you got to take care of you. So 10 minutes a day, that's it.
Thank you, Bridget. Dr. Claire.
Yeah, exactly. Well said. And meditation is the key, because that way you're leaving your outer activity, you're leaving your peripheral body, so that you can get within where you can get yourself back into balance. And the really most important thing is start your day before with the meditation before your day starts you. So by doing that, setting that intention, or just getting into the stillness, then what you're doing is you're allowing yourself to go forward. And then as many times in the day as you need to, take your breaths, just to get yourself back into balance again.
Fantastic. I put it in the chat. Start your day before your day starts you. I'm going to use that. That's brilliant. Dr. Vicky.
Well, I echo and applaud both of you for what you said, hugely important. One of the things I would always find with people, even when they were in my appointment, is they always, if they're this kind of a person, they always have to be moving with their fingers, with their hands. Those are the people who are also doing this when they're at their desk. And the hand to mouth is just a nervous habit, but what is in that hand to mouth can get them in trouble. So you end up throwing not only your entire GI system off, you throw off all of your insulin, which throws off your thyroid, which throws off your stress. So realize that some of your nervous habits are some of your worst enemies. So if you find that you have to have a candy bowl on your desk, take it away. Go put it in a cupboard someplace. If you find that you have to be a gum chewer, then maybe you don't need that gum. Maybe you could be a water sipper or a hot tea sipper. Change some of the habits that you find get yourself both on a do loop where you're just doing a habit, you don't know why you're doing it, but this habit can get you in a lot of trouble, and it tends to carry over from morning to afternoon to evening, and that after dinner snacking can be such a horrible thing for that mid-abdominal weight none of us want, yet we willingly do this without realizing this. So pay attention, love yourself. I love that idea. Love yourself first. And if you're doing a nervous habit, have somebody else at work with you say, hey, why are you doing that? That's your 4th piece of candy you took from that bowl. I'm taking that bowl away from you. That's said with love. So accept that and be kind to yourself.
And what is the program that you're playing that is having you behave in this automatic way? And again, that's where the high potency homeopathics come, or the energy work is helping us to free ourselves from the programs that are keeping us below the line.
Well,
Dr. Claire, can you talk just a tiny bit more about above the line and below the line and what you mean? There might be some people here not as familiar with that.
Okay, well, above the line to us are emotions that are more, if you want to call it spiritual, more divine, like love, gratitude, appreciation, like for no reason at all. We just are that. When you're below the line, we talk about as being in our human state, anger, fear, anything that is lack or limiting from the that divinity that we are supposed to be. And then what we do is we requalify that and come back as anger or in our responses or disappointment or sadness or whatever it is. And then as soon as we are in that frequency, then our body is going to be responding to that frequency physically. So then it's going to, because all disease is basically just a lowering of frequency. And so the lower those frequencies are, and they're all the ones below the line are all very slow frequencies, that's what we want to do is to be above. And again, what you're saying about David Hawkins, great stuff with what he was saying. And we just want to make sure that we are giving our body the best thing that we can do and not qualifying it into something less than.
Thank you. And it's not that all the emotions are there and they're human and they're natural, but it's, do we stay in them? What do we do?
Yeah.
Do we let them flow through us and pass through us, or do we stick in those? And
Yeah.
like Bridget said earlier too, feeling like victims, sometimes we might need to be there for a minute or two or 10, whatever it is. But if we stay there forever, it's going to be to our detriment.
Right.
And like Vicki, Dr. Vicki, your story about the woman who was just constantly like this and just not able to be in the present moment at all. That is so not above the line. Ooh, I'm getting anxious even just doing that. Taking a breath and being in that. What a fantastic discussion. I don't see any other questions.
I want to comment one of the chat
it.
things. She said 20 minutes doesn't work for me to step away. I'm trying to move while I'm working. Get a stand-up desk. Or even if you can't get a stand-up desk, put a couple of boxes there and put your computer keyboard on the box, because now you're standing and you're going to have a completely different rhythm and flow standing working than sitting working. So easy things you can do.
Fantastic. Any final comments from our practitioners? I have a couple quotes I'm going to read.
No. Just live your life authentically.
Brilliant.
Be kind to yourself.
Yeah. And getting back to what you were saying, Vicki, we also knew a fellow that not only had a stand-up desk, but he didn't have a chair, he had a treadmill. And he was working on the treadmill the entire time that he was doing the other thing. I don't know if that would
type on a treadmill.
Yeah, I think it depends on the kind of work. I know I can't stand up all day, but I really do need to stand up more. So that's good. Bridget, any final words from you?
Just do you and be happy. It's your life. No one can take that away from you. So just do you.
Fantastic. I have a few quotes we'll end with. Antoine de Saint-Exupéry from Le Petit Prince, it says, "It is only with the heart that one can see rightly. What is essential is invisible to the eye." And Zig Ziglar, "Among the things you can give and still keep are your word, a smile, and a grateful heart." And Confucius says, "Wherever you go, go with all your heart." And finally, Rumi, "The only lasting beauty is the beauty of the heart." Thank you for being here. Practitioners, you have been so incredible. I've loved this conversation. Thank you to all of you who have been listening, whether you're here live in person or watching this after the fact. We appreciate you. Thank you from the bottom of our hearts.
A pleasure.
Thank you.
We're so glad you're with us, and we're doing this because you matter.